Happy New Year. I know I haven't done a video face-to-face in a while, but I just want everyone to know that I am still going to be doing plenty of obviously mental health videos and health-related videos in general. Now, this is a video that I forgot to do a while back when I was talking about the shots of Benadryl, Haldol, Ativan, and as well I talked about Thorazine and briefly hit on olanzapine or ZYPREXA. Those are shots that a lot of times that are giving in the psychiatric setting. But there was one other shot I wanted to discuss as well, /pill, that is used for psychosis, paranoia, bipolar disorder as well. And this is GEODON. Now, GEODON and olanzapine or ZYPREXA, they're two separate atypical antipsychotics. Okay? They're both atypical antipsychotics though. GEODON, a lot of times it's considered a little bit stronger than olanzapine. But I will say with GEODON though, one benefit in particular is developing things such as metabolic syndrome or even just metabolic disorders is a lot lower than ZYPREXA or olanzapine. I'm just going to call it ZYPREXA for right now. One big thing with that is as you increase the dose a lot of times with GEODON from 10 to 20 to 40, because it's in capsules, it's not in tablets, at least not in America. With it, a lot of times you can go up on those doses, and in particular things such as weight gain, which is extremely common with a lot of antipsychotics, and this goes even Haldol, Thorazine if you take that long term. But this is so weight gain with a lot of times with atypical antipsychotics or antipsychotics in general, weight gain is fairly common. But GEODON is the one, once again, where lower doses, it's a pretty effective medication as it is, but if you have to raise your dose, because over time, if you take it, you naturally build up a tolerance. It's a physiological response that we have. You'll have to raise it a little bit, and a lot of times people have reported, in particular patients, that weight gain has not been a huge problem, and in particular insulin resistance as well. So those are two big game changers with it. I'm not saying it can't happen, things such as insulin resistance or weight gain, but it's a lower chance of happening. Obviously, if you have anything such as diabetes type 1 or 2, you have weight gain issues from antipsychotics in the past, this is something you should be discussing with your doctor. And if they're wanting to put you on GEODON or even ZYPREXA for that matter, that should be something they should be bringing up to you. Now, and that'd be if you were taking it more so long term as a daily medication. Sorry, I know I'm a little bit everywhere with this video, but it's just something I wanted to go ahead and cover. Now let's real quick go back to ZYPREXA. ZYPREXA has a lot of good uses though. Some of the pros of ZYPREXA is it is prescribed a lot of times off-label for things such as anxiety, as being a sleeping aid. I know a lot of times in the psychiatric setting, if somebody comes in and they don't take any, they don't have any medications they've been taking before coming in, and if they have no allergy to ZYPREXA, that's something that at night a lot of times, if they have problems with insomnia or they can't sleep because you're in a new environment, that's something a lot of times that can be offered to them as a sleeping remedy, and it's very effective. As well as one big thing with it as well is it's not addictive. Not saying people aren't going to have problems with it. There's always some people who can find things addictive, but overall it's not an addictive medication. However, one problem with ZYPREXA is one big thing I've seen at least is, as we just discussed, weight gain, and also, and this is more long term, things such as insulin resistance and metabolic syndrome is you have a lot higher chance of potentially developing that. And a lot of times patients will even say, or I even know somebody who takes ZYPREXA, one thing is, one common question that is asked is, well, what if I exercise? What if I exercise? I'm eating healthy, will that help? A lot of times, unfortunately, if you're taking a high dose of it, there's only so much you can do to really assist with it. It will help, but a lot of times it's just a physiological process that long term, and if you're taking higher doses of it, can develop. Just depending on your gene pool as well, you do have a potential risk of developing it, especially long term with higher doses, in particular with ZYPREXA. But once again, one good thing about both of them is they're typically non-addictive medications, okay? When it comes to, in long term, once again, you can, if you're going to take it long term, GEODON sometimes can be more effective in regards to not developing things such as weight gain, and also even type 2, or even if you have diabetes in general, not having flares with it, having big swings that'll have to make you go to the hospital. Also, with GEODON, a lot of times if you haven't taken it, they will do an EKG to see if you have a prolonged QT interval in general. That's fairly common. But when it comes to the shot form, when it comes to taking a shot, meaning let's say you need this a one time, I would say GEODON a lot of times is more effective than ZYPREXA. ZYPREXA works in a shot form, which I've discussed in the last video. But if it's true paranoia, true psychosis, a lot of times GEODON will work a little bit better. And if, for example, ZYPREXA isn't working, it works as a good second line defense as a shot to give instead of something such as like Thorazine. My number one shot in general will always be, when there's a go-to and there's no allergies, will always be a B52, Ativan, Haldol, Benadryl, which I've discussed. ZYPREXA can be a good one as well if there's no history of getting other injections and there's no allergies, but a lot of times it's just, I don't find it that it's that effective for patients. And another big thing I wanted to discuss with these, when it comes to more side effects from like first time use or potential allergies, I will say I've actually seen more with GEODON in regards to this. One time I saw there was a patient who took it and they developed seriously bad lockjaw, to where they honestly couldn't even really open their mouth. And I was like, because sometimes, people can just act, can act like, oh, they're lying. I mean, it happens sometimes, especially when you work in a psych hospital or just in general. But no, this person literally could not open their jaw. And also they were having seriously bad paranoia and hallucinations. They had tried ZYPREXA in the past, right? They had tried that. It was not effective for them. And also, interestingly enough, they had an allergy, it said, to it, that atypical antipsychotic, but they're given the go to take GEODON, which is also an atypical antipsychotic, but different. And from there, they were having horrible lockjaw, horrible paranoia. It made it to where they could not sleep at all, and a racing heartbeat. So there are side effects that come with it. On the other side, I've also seen people who take it more so long term, and this is with ZYPREXA and GEODON. In both these situations, surprisingly, common side effects besides the locked jaw, in particular with GEODON, I've never seen that with ZYPREXA, but it can be a side effect. A big thing to watch out for is horrible racing thoughts, hallucinations, and also not sleeping, not responding. So it's essentially making everything worse. A big desired effect if somebody's going to take it, and this is once again for ZYPREXA, if they're getting it in a shot for being paranoid, obviously the intended effect is okay to help them calm down or maybe help them sleep. But if it's not doing anything, which can happen because it's a lot of times not super effective for everyone. But if you notice they're starting to say, my heart feels like it's racing, more racing thoughts, that's something to monitor for, because that is a sign of a reaction, and potentially that can lead to loss of consciousness and some consciousness issues as well, which can be a sign of potential delayed anaphylaxis. So that's something to look out for. I know that was kind of everywhere with some of this information, but I wanted to go ahead and throw that out there because I realized I didn't do that video earlier. But just so everyone knows, we're still doing mental health. We're still going to be covering all health stuff, health in general. We are adding to it, as you've seen, probably some of my more personal endeavors. I like to cover things such as even Bible stories. We'll be doing that. We'll be doing a little bit more just into my personal life as well. Just things going on. Still running, doing shorts. But this one didn't really have any sort of order, this video. I like just doing these just to kind of do videos still in general, and also just like talking about different medications and whatnot and things I see. But everyone be safe. I don't really do a New Year video, a New Year's resolution, because I really don't think that New Year's resolutions are a real thing. If you actually, I mean, it can work, I guess, but if you're under the impression that you're going to make some dramatic change right now, which is great, a lot of times in 2 weeks you got to make that change. You got to want to make it. You can't wait for a date to make that change for you. Oh, and also with me as well, I got rid of cable. I don't like watching TV that much anymore. I still obviously have social media. That's what I'm doing here. But I'm wanting to do this channel as well, more so to inform you of everything. Just inform you of what's going on, what's helping me in my personal life, and doing a lot more reading as well. That was something I was really lacking on over the past, really forever. I was never really an avid reader, to tell you the truth. But I've been reading a lot more, and I can already tell you, just from speaking to even brain fogginess and whatnot, I do feel like it's helping, because I'm past the placebo effect with it. I've been reading now really for about the past, every day for the past 6 to 7 months now, every single day, and I can't believe how many books I've already went through. But it is a game changer in so many ways. So I've been reading a lot, but yeah, and I'm still doing videos like you see out here. We're still going to do more personal face-to-face videos, but I just want to do this video. I know it was everywhere. I'm going to be putting out a lot more videos, and as I change, as you guys change as well, that's what this channel is about, is marking these changes in my life, because interest of mine obviously change. We're human, but I'm going to document them all. So yes, this is still obviously a mental health channel. We're going to cover mental health disorders as well, you name it. But we're going to be diving more into just some of my outside interests as well, and just go from there, because I want to document, once again, at least once a week what's going on in my life, what's going on mental health wise, because this channel, hopefully it helps you, it helps me as well. I love you all. Like, subscribe to the channel, leave a comment. I know that was a very random video, but I still like doing these type of vlog videos as it is. We'll have more videos out soon.